Hello, my name is Cara Clennell Proctor. I'm a staff nurse in the emergency department at Trillis.
You've been through an apprenticeship programme to get where you are now, Cara, but that wasn't the field that you were working in when that happened. Tell us a little bit about your story and your journey.
Beforehand, I was in the managerial role of retail for supermarkets, and I became quite poorly and I needed an emergency operation, and that was quite severe on my health. So afterwards I felt like when I was recovering, I felt like I needed to give back to the NHS. So I went back to college and did a course to get into my qualifications so I can go to university. I didn't know I was dyslexic at the time, but when I started university, I got assessed and I got told I was dyslexic. Unfortunately, I failed my first year in university, but I did bank as a healthcare, so that started giving me healthcare work. In 2011, I joined the emergency department at Trillis, where I'm currently working. I started off as a Band 2 healthcare, and I got into the apprenticeship programme, and I worked my way up to an assistant practitioner, which is a Band 4. I also did a skills module just beforehand to help me get back into learning, and then it was actually my matron who carried on with my apprenticeship course who put me through to do my nursing degree and sorted out funding and placed in secondment for 2 years to come away from the department to work. So it was actually my matron who helped me get into my nursing. And in 2020, when I was 40 years old, I became a qualified nurse and I got a first in my degree.
Wow, well congratulations and well done you. How valuable and rewarding did you find the apprenticeship process and programme? Because it really sounds like, I mean, since you first started out from that moment where you'd had the surgery, you're in a very different place now.
Yeah, so I've made lots of friends, and I'm still friends with some of the people I did my throughout my courses with, and actually the apprenticeship team at university and here, they still they're quite proud of how I've achieved as well. When I see them and things, I'm still getting good reports and things. So from them, so it's good encouragement. So I do feel really proud of myself, and without their support and without their funding, because I certainly also, that's another thing, financially, I couldn't afford to go to university. So I certainly couldn't leave a full-time job, which I was in, to then take 2 years out to do my nursing degree. So without the funding support, I wouldn't have been able to do that. So it's a massive achievement. And I know when I was diagnosed with dyslexic, I always struggled through school. And then when I got my results for a first, I thought unbelievable how amazing that is, you know. So I wouldn't have done that without support of my family and Trillis and, you know, the university and everyone involved in the apprenticeship team.
What would you say to anyone who maybe they're just starting out in the world of work, but maybe they're already in a different job on a different career pathway? What would you say to them to encourage them to maybe think about the apprenticeship route?
Definitely go for it. If it's what you really want, you will get support to do it. Some of my friends have children and they did it, you know, it's that work-life balance. You do get that at work anyway, but in university it is quite flexible, and they're there to support you because they want you to pass. They don't want you to fail. They want you to help you with your home life and your work life. And I had that good balance. It is hard. It's certainly not easy courses, but I think it's your determination and your help that you get. And I think I had to personally study every day to get my results. So I had to put in hard work. It was not easy academically for me. But I still found it rewarding, even though you have days where you're struggling or you don't think you're doing as well, but it gives you encouragement. You're looking at the bigger picture, and that's what you've got to focus on. It's going to improve your life, not make it worse. So definitely fully go for it.